Hello, this is Robert M. Ross, and I'm a licensed professional counselor here in the state of Pennsylvania. I'd like to welcome you back to my channel, which is called The Common Sense Lifestyle. Now, today I'm going to talk about something just a little bit different. This is a topic for men, and the name of the topic basically is Your Testosterone and You. And as you know, testosterone is kind of the master hormone for men, and it's kind of what makes us men. But as a disclaimer today, I'm not a medical profession. I do refer people for medical examinations and stuff like that when I think there may be something going on there, but I'm not a medical professional. I can't make a medical diagnosis. I can't write a prescription. So everything in this video is for informational purposes only. If you do have any questions about your health, I strongly encourage you to seek out your doctor as soon as you possibly can. Also, as I like to say in every video, if you are feeling suicidal, if you're feeling like you're having severe psychiatric symptoms, I'm going to put a national suicide hotline in the description below. Please make use of that if you need to. Also, as always, I am not your therapist. This is not a therapy session. Again, this is only for informational purposes. So please, please, please just take care of you, do what you need to do. And if you need to see someone, find a competent professional in your area. You can talk to your insurance company. You can go on Psychology Today and use their Find a Therapist function and find someone to speak with. Again, suicide is a long-term solution to a short-term problem. Most things get better. Don't take that step. So again, for today's topic, we're going to talk about testosterone, which is the master male hormone, what makes us men. It's typical in psychological practice, my work as a counselor. If we run into someone that we think they're having a physical problem that might be causing their psychiatric symptoms, it is advisable to refer them to their primary care doctor, get checked, get tested. Probably the most common example of this, and this is just kind of to set up my points later, if you have thyroid issues, and thyroid produces hormones. If you have a problem with your thyroid, it can cause you some emotional issues. And this is from the Mayo Clinic. I'll put the link in the description below. But if you have an overactive thyroid, which is called hyperthyroidism, you may experience unusual nervousness, restlessness, anxiety, or irritability. On the other hand, on the opposite end of the spectrum, if you have an underactive thyroid, which is called hypothyroidism, you can have mild to severe fatigue, depression, and still, it's unlikely that just emotional symptoms like anxiety, depression will be the only evidence of a thyroid issue. Thyroid issues can also include physical symptoms like weight gain or loss, increased sensitivity to hot and cold, bowel movement changes, and menstrual irregularities. So, just kind of an example, if you have one hormone out of whack, it can really damage you. It can really cause you a lot of problems. But as I was indicating earlier, we are hearing more and more about what we would say is a growing problem, and that is men having low testosterone. So here's some information about that. Here's some symptoms of low T. Lower sex drive. Guys end up just not being interested. Erectile dysfunction. Sometimes it's not just the little blue pill that you need. Low semen volume, hair loss, fatigue, loss of muscle mass. Increased body fat, decreased bone mass, and mood changes, which can include depression, irritability, or lack of focus. A lot of guys describe it as a brain fog. So we know kind of what the symptoms of it are, but what are the causes? What causes people a guy to have low testosterone at some point in their lives? Injury to the testicles. That could definitely do it. They would call that primary hypogonadism. Testicular cancer or treatment for testicular cancer, hormonal disorders, infections, HIV or AIDS, chronic liver or kidney disease, type 2 diabetes, or obesity. And this is from WebMD. Again, I'll have the link in the description below for your information. But these are some of the things that can cause. And note obesity, because that is definitely something you can control. So that comes into play later in our talk. So how do we diagnose low testosterone? Well, you go to your doctor and you ask them, you explain to them what's going on, you ask them for tests to see if it's that, and you go get the blood work done. It's a simple blood test. It's nothing really complicated, and the results are back relatively quickly, and you and your doctor can sit down and discuss those. If it is diagnosed, how is it treated? Your doctor may prescribe testosterone replacement therapy, TRT. Now, this is done in a variety of ways. One is injections that you would actually, stick a needle into one of your muscles, and you do that every few weeks. Now that can be done at the doctor's office, or that they can teach you how to do it, and you can do it on your own. Patches or gels that contain testosterone that you would put on your skin. Do have to be careful that children, females, don't get exposed to the place where you administer that, because that could cause them some problems. Testosterone that's good in a guy at levels would not be really good in a woman at the same levels. In a woman at the same levels. Another method is a tablet-based patch that can be applied in your mouth, and you change that every 12 hours. And a newer form is testosterone pellets, which should be injected into your skin and would slowly release testosterone over the span of a few months. So those are some of the things that your doctor can do to help you with this issue. There are other things that you can do for yourself that can help your testosterone level. Losing excessive weight and being physically active can raise a man's testosterone level. Getting enough sleep. 7 to 8 hours a night of sleep has been scientifically proven to increase testosterone. Again, keeping a healthy weight, staying active. Exercise is good for your testosterone, but what research is telling us is that resistance exercise and weightlifting is even better. It's the best kind of exercise for testosterone levels. And another one is take care of your stress. When you're under a great deal of stress, your body releases a stress hormone called cortisol. And cortisol has been shown to interfere with your testosterone level. So please, do what you can. Of course, obviously, life is stressful enough. Life happens. We can't always control for that. But if you take some steps, take care of yourself. Take a vacation. Learn mindfulness or relaxation training, or do yoga, or do something like that that helps calm your mind. That will actually help your testosterone level. So now none of those things are going to make a super huge dramatic difference, but it certainly will put a dent in the problem if you have it. A controversial thing, and I'm going to say this because there's going to be debate on either side of the issue I'm about to discuss. And that topic is soy. Soy is a common ingredient if you look at your mayonnaise container, your ranch container, your peanut butter container, which probably a lot of doctors say you shouldn't have any of that in your house anyway. But if you look on a lot of things, a lot of products that you consume, soy oil or different ingredients from soy are a very common ingredient. Now, the critics of soy will say that soy does contain phytoestrogens. These are chemicals that get into your body and they act like estrogen. And estrogen will kind of zap your testosterone, so you don't necessarily want to have that. It's kind of where we get the phrase soy boy that's been thrown around here in the last couple years. And soy boy is a derogatory reference to kind of effeminate men that, maybe do have low testosterone, may or may not. So there are a lot of critics out there that will say that soy should be avoided at all costs simply because you don't want to be putting estrogen in yourself. One of the things that I've seen in my own practice is I've had multiple menopausal or postmenopausal women in my office treating them. And several of them have said that their OBGYN instructed them to drink soy milk, to consume soy products, because it would help balance out their estrogen levels. It would help increase their estrogen. If OBGYNs are telling women to take soy to increase their estrogen, it's probably not a product you as a man want to have anything to do with. Now, same token, there's guys on the other side of this issue, folks, companies, whatever, on the other side of this issue that will tell you that soy is perfectly safe. It's a great source of protein, and all that stuff. So there is controversy about this. I don't think the research has been completely clear on this yet. So there's a lot of opinions out there. I'm not going to provide links on this one. I would encourage you to look into this yourself, and if that's a step you want to take, it's a step I decided to take. One of my monthly plans of this year was, I called it the war on soy. So I found everything in my life that contained soy, and I got rid of it because, at the very least, I just change the products I eat. That's one less processed food that I'm consuming. So another thing, avoid quick fixes. If you are having some low testosterone issues or you're having the symptoms, the internet is full of quick fixes for you. There's some guy's magic pill that you can take and it's going to increase your testosterone. That's a lie. It's not going to happen. If you look at the bottom of news websites, many times you'll see ads at the bottom of the news story. And one of my favorites from a few years ago was a picture of a gigantic guy. Guy had to be photoshopped because nobody looks like that in real life. Giant muscles. And I think the caption was, "New steroid alternative putting gyms out of business." Okay, anyone can sell snake oil online and say that it does something when it doesn't. So please, please, please be aware of that. Don't go for quick fixes. If it's a quick fix, it's not a fix at all. And that's kind of my saying with those things. Take steps to help yourself. Do some things that you need to do. Go talk to your doctor. Get yourself checked out. And talk to your doctor about the treatments. There are a whole lot of other areas that I could go into with this topic, but I'm not a medical professional. This is something you do need to talk to your doctor about. So I'm going to drop it off at here. I hope you guys have a great day. Please please hit the like and subscribe below. Hit the bell so you'll be notified if I put out new videos.